Hi, this is Meg. I'm a second year physiology student, and today I'm going to attempt to explain to you chloride's role in tissue excitability within the nervous system and skeletal muscle. We can see from my whiteboard that chloride is in higher concentration in the ECF than what it is in the ICF within these cells here. It moves down its concentration gradient into the cell, making the cell more negative, hyperpolarizing the cell and generating an inhibitory postsynaptic potential. So within the nervous system, we have low chloride conductance, which reflects having less chloride channels on the cell membrane, which makes it less permeable to chloride. We only need a small excitatory postsynaptic potential to release a neurotransmitter called GABA, which is an inhibitory neurotransmitter from this presynaptic cell here. On the postsynaptic cell, we have GABA receptors. Today I'm going to talk about GABA A and GABA B receptors on the membrane here that GABA will bind with. GABA always has an inhibitory effect on the cell. GABA A receptors increase chloride conductance into the cell, which hyperpolarizes the cell. GABA B receptors are G protein coupled receptors that increase potassium conductance and decrease calcium conductance, which again hyperpolarizes the cell. If we were to take a drug such as benzodiazepine, which is a central nervous system depressant, it will also act by binding to these GABA A receptors, and it will increase, again, the chloride permeability by changing the rate at which these chloride channels open, which creates this inhibitory effect on our central nervous system and all its neurons. Alcohol exerts a similar effect on GABA A receptors. So if we were to take benzodiazepines with alcohol, we'll have this double depressant effect. Again, with barbiturates, what they do is they bind to these receptors and increase the duration of chloride channels, the duration of which they are open. When GABA binds to GABA A receptors, which again, if taken with benzodiazepines or even alcohol, will have this double whammy effect on depressing the central nervous system, which is quite dangerous to anyone's health. I'll move along to skeletal muscle, which has a high chloride conductance, which is reflected in having more chloride channels on the cell membrane, giving it a high chloride permeability. So we are going to need to have a larger excitatory postsynaptic potential to create any effect on this cell over here. What I've drawn here are CLC1 channels, which are activated by the depolarization of the cell, along with the concentration of chloride in the ECF and pH, and also ATP. They contribute, chloride actually contributes 70 to 80% to the repolarization of resting cell membrane potential in skeletal muscle, which is much more important than potassium's role, which we see in the nervous system in repolarizing the cell back to resting membrane potential. These CLC1 channels are double-barreled or double-pored channels, which have gates that can work independently of each other quite fast, and they also have a common gate which functions quite slow, which is quite a complex process that I'm not going to go into today. We can have channelopathies of these chloride channels, and one channelopathy I'll talk about today is myotonia congenita, which is caused by the mutation of these CLC1 channels, which reduce their conductance of chloride up to 25% or more, 25% or less, should I say. So what we're seeing is less chloride permeability into the cell here, which means we are going to need a smaller EPSP over here in the pre-synapse, and what this does is causes an inability of muscles to relax after voluntary contractions for some period, meaning we're not seeing as much of an inhibitory effect. We're seeing more of an excitatory effect on these muscle cells for a longer period. We were showing an example at the beginning of this subject with the myotonic goats, which is actually quite hilarious. So I hope I have explained clearly enough the role of chloride in excitable tissue, and I would just like to acknowledge my resources that I used, which I will just bring up now, which is Berndt et al., Cannon, Jenst et al., Jewett and Sharma for their research on this topic. Thank you.